Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Dr. Tahir Shaheen. I am a GP in Bradford and I also work in the Accident Emergency Department. I've been asked today to share a few words with you once again regarding the ongoing COVID-19 pandemic and its impact in our communities. First and foremost, I would like to take this opportunity to say thank you. Our community has demonstrated commendable attitudes and exemplary compliance in following the government guidance during this difficult lockdown period. And our actions collectively and certainly will have helped save lives. The last 2 months during the lockdown have been a very difficult time and a challenging time for us all. Not only have we had to adapt our ways of living by observing social distancing and keeping away from our friends, family and loved ones, but also in the hope of saving lives, we have sacrificed some of our dear traditions during the sacred month of Ramadan, abstaining from congregations and iftar, and also suspending our evening Taraweeh prayer at the mosque. This is not a small sacrifice, and be rest assured that this will not go unrecognized, and our efforts will certainly go down in history. But for now, I would like to bring your attention back to the facts. Why have we been able to keep the numbers in our city low, and how have we been able to save lives? And in keeping with the spirit of Ramadan, I think it's a very important time to reflect and help us realign our focus and priority. As we are all aware, recently the government has made some subtle alterations to its strategy, but essentially, the rules for us remain more or less the same, and nothing has very much changed. Therefore, our message remains very clear. This is not a time to take our eye off the ball and to become relaxed and complacent. The infection is still present and continues to present a very serious threat. Our communities, particularly the ethnic minority population, remains a high-risk group. The recent statistics have demonstrated that the infection rates in Yorkshire and the North East remain the highest, and our busy hospitals and wards remain testament to this. We are far from any treatment, vaccine or cure. So the blunt reality is that this infection is here to stay, at least for the foreseeable future, and continues to present a very serious threat if we do not take this seriously. So let's all take a lesson from history and try our level best to prevent a second surge and prevent further fatalities. So for now, the advice remains ever more pertinent, and I would like to reiterate some of the take-home messages. Number 1. If you display any of the following symptoms: a fever, new onset continuous cough, absence of smell or taste, then it is very important that you self-isolate for 7 days, and any household contacts also self-isolate for 14 days. Number 2, please continue hand washing. This has been one of the most important interventions to help reduce the spread of infection. Please continue washing your hands with water and soap for at least 20 seconds and continue sanitizing and cleaning your surfaces at home regularly. Number 3, please continue to observe the social distancing measures. By definition, this means maintaining a safe distance of approximately 2 meters between yourself and somebody else. And remember, we still pose a huge threat to those vulnerable and elderly who may have been shielding, as many of us are asymptomatic carriers, meaning although we may not show the symptoms or have had the symptoms, we still carry the risk of carrying and spreading this virus. The message of social distancing becomes even more of a priority with the upcoming celebrations of Eid al-Fitr. It is completely understandable that many of us are becoming very frustrated with the lockdown rules, and Eid is an enticing time to come together as families. However, our message remains very clear. Please stay at home. Please celebrate Eid at home. Look after yourselves and your families. Secondly, avoid handshaking and embracing each other. As the saying goes, a hug will spread the bug. Thirdly, only go out if it is absolutely necessary. And fourth, although we appreciate it is part of our tradition and custom to visit the cemeteries on the day of Eid, the traffic of people will make observing social distancing very difficult. So we strongly recommend that you stagger your visiting of the cemetery over a number of days during the Eid festivities. There has been emerging evidence that vitamin D supplements are beneficial and helpful in the COVID-19 disease illness. It is therefore recommended that you take regular vitamin D supplements, and please contact your local pharmacy or health store for further information. In summary, it has been a very difficult and arduous journey for us all. We have come a very long way, and it would be a shame to undo the progress and waste our efforts. It is also very important to remember that there is an overarching responsibility for us as good Muslims and citizens to look after ourselves and those vulnerable in the community. So let's continue in this endeavor united and help to overcome this crisis together. Finally, I would like to wish everybody a heartfelt Eid Mubarak. Stay home, stay safe, stay blessed. Jazakallahu khair.